So planning. So for planning, um, your main task is to identify two nursing problems based on assessment station and write care plans about it. So make sure when you do your planning, you follow SMART format, okay? Make sure it's specific, make sure it's measurable, it's attainable, realistic, and time bound, okay? That is the basis when you're doing your care plan. Have you heard of this before? I guess so. Okay. Make sure it's again specific, measurable, attainable, relevant, or realistic, and it should be time bound. Okay. Have you heard of NANDA before? NANDA. Have you heard of this before? The North America Nursing Diagnosis Association. So we are in the UK. We're not using it. Okay. So make sure you simplify because I know most of you guys you're following the US textbooks. Okay, so we are not using that here. When you're developing problems for your OSCE, make sure it's simple and you follow the SMART format. Okay, so always ask yourself: Is this problem specific? Is this problem measurable? Um, is my goal attainable? Are my interventions realistic and or relevant to the problem? So next is identifying. So grab your care plans. The first part of the care plan is identify the nursing problems. So at this stage, think of about what problems the person in your care has presented and what are the most important problems that you have to address. Okay, so the examples are shown on your screen. Say pain, anxiety can also be a problem. Immobility can also be a problem. Let's say shortness of breath. Let's say risk of bleeding. So yesterday during our quiz, you'll learn that there are two types of problems. You have the actual problem and the potential problem. Okay, so actual problem, it's happening now at this very moment. Potential problem, it may or may not happen, but we need to take some action to prevent it from happening. Okay, to prevent it from happening. So when you do your care plans in the OSCE, so you are talking to an actual person. You're talking to an actual person doing assessment. So during that 15 minutes, you might be thinking of couple of problems based on your assessment. So you make sure you prioritize. Okay, it's also you demonstrating your prioritization. Let's say you've identified five problems during your planning. So what are your two top problems that you have to deal with? Okay, so what are your two top problems? Again, for you to be able to pass your planning station, you have to come up with two care plans. So if you check your care plan, so Emmer, there is a third page. Okay, there is a third page. On the third page says there, use this in case there is an error. Okay, you are not meant to use it. Okay, you are not meant to. In case there's like an error to say you ruin the whole page of planning. Hopefully not on the examination. That's the time you will use it. Okay, again, only two care plans are needed for you to pass planning. When you're identifying the problems, make sure you analyze the scenario. Okay, make sure you analyze the scenario. You read the scenario carefully. Some of the scenarios, let's say assessment, it's pre-op. During planning, the scenario might have changed. It's post-op. So you make sure you read the scenario carefully. Okay, this is where all the fails are coming from because candidates tend not to read the scenario carefully. So aim of care, it must address the problem. A classic example is say the problem that you've identified is pain. Definitely the aim of care is not for shortness of breath. Okay, simple, simple. Okay, make sure it answers the problem. Okay, next is the reevaluation date. When will you review the problem? So it's not asking for the actual date. Again, it's not asking for the actual date. So let's follow this format when you're answering the reevaluation date. It's after, write it down, after, hours, days, or weeks, and if the patient condition changes. Okay, on that section, again, for the last time, after, hours, days, or weeks, and if the patient condition changes, similar to the example that I've given you on the past. So the care provided or the intervention. And this section, make sure it's current, it's evidence-based and best practice. Okay, again, it must be current, evidence-based, and best practice. It should be the practice here in the UK, okay? Not in the Philippines, not in India, not in Nigeria, not in Cameroon, not in Kenya or Ghana, okay? It should be in the UK, all right? Next is, so those are the parts. I think I'm missing one. The other part that is missing is the patient self-care. So the patient self-care is what the patient can do for himself. Okay, what the patient can do for himself or what the patient can perform independently. Normally, what you will write on the care provided is just you mirroring on the other part. Okay, later we'll have a practice. All right. So this is our example. Okay, so you've all met Jon Snow. On your candidate pack, if you go to planning section, let me read the scenario. So Jon Snow was admitted to the medical assessment unit today via GP with an exacerbation of asthma. John has had previous admissions to intensive care. John has had a cough for 3 days that is producing green and gray sputum. Based on your nursing assessment, please produce a nursing care plan for two relevant aspects of nursing care and self-care suitable for the next 24 hours. So that is your task. And it says, um, create two care plans based on your assessment. So let's pretend that you've done assessment. Okay, let's pretend you've done assessment, and based on your assessment, the one on your screen are your findings. Okay, the one on your screen are your findings. So John is complaining pain on the chest when coughing, and that's 5 out of 10. Okay, 5 out of 10. Next is John reported shortness of breath, and then you check his respiratory rate, it's 31. It's on the high side. If we think about it, remember 25 and above, it will automatically, John will automatically score 3 in a single parameter. Okay. Next is, yeah, see on the screen it's showing the news is 7. So the temperature is 38.8. So also John is also experiencing fever. He's febrile. So John is also anxious about going back to ICU. Another one is John doesn't have any allergies. He is on inhaler. He's still for recess. He is a smoker and a social drinker. He's non-compliant with medication. He is worried about his wife who is pregnant. He is independent with activities of daily living. Then days ago, he's complaining of difficulty in sleeping or interrupted sleeping because of the shortness of breath. I believe the reason behind it is John cannot lay flat. And he wakes up in the middle of the night. And he doesn't have any communication problems. So these are your assessment. So when you do your assessment on the examination, this might be your findings, okay? So based on these problems, you have to prioritize your two problems. So I want a brave soul. Who wants to give it a try? Raise your hand. Our birthday girl. So what is your problem? There you go.
After assessing John's complaints, I will prioritize his needs.
So what is your problem then, Melvis?
So my initial problem or my initial concerns will be John's shortness of has got to
Shortness
do
of
with his
breath.
breathing.
Okay. How are you going to write shortness of breath on the first section? The first section is identify the problem. How are you going to write it then?
So I'll say patient has difficulties in breathing related to shortness of breath.
Is it the same? I think it's the same. You can change the patient to his name, John.
Okay.
All right. Okay, to make it more tailored for John.
Okay. John is unable to breathe properly due to the shortness of breath.
And then what do you want to add? I mean, to make it measurable. How about the respiratory rate?
I'll say yeah, his shortness of breath is because he's breathing fast. His respiratory rate is above 25.
Or you can say 31. Okay.
So yeah, his new scoring is above 3, which is an immediate cause of concern.
Let's remember SMART. So make sure it's specific. Okay, specify the problem. She can probably say, John is experiencing shortness of breath with respiratory rate of 31. So why am I including 31? Remember SMART, measurable, because at the end of your care plan, during your evaluation, how will you know that your interventions worked? Probably after um it's down to, like, say,
Evaluation.
the normal one,
Oh,
back to
yeah,
15 or 20. Okay, so that's what I'm trying to say. Okay, to make sure it's smart. Okay, next, Melvin. So what will be your aim of care?
I want him to breathe normally.
That is it. So how are you going to write it, Melvin?
So John is able to breathe normally.
That is it. And then probably you can include the normal values for respiratory.
12 to 18.
12 to
Beats
20. Okay, 12 to 20.
20.
All right,
Yeah.
so probably you can write John will be able to breathe normally with a respiratory rate of 12 to 20. Okay, so at least you have a range. It's realistic. Because probably, remember, even if you give like nebulizer or this medication, sometimes 31, it's hard to put the respiratory back to normal state, isn't it? At least you have the range. Okay, it's realistic. When is your reevaluation date? Following what I've just mentioned earlier, how are you going to write your evaluation date?
I'll make sure that John's vital signs or respiration rate is taken every 1 hour or 15 minutes.
Well done. Okay, so how are you going to write it then, Melvis? So after
every 1 hour, pulse respiratory rate is taken and recorded.
Okay, well done. So, or simply say after an hour and if the patient condition changes. So, after 1 hour and if the patient condition changes. Can we also write continuously and if the patient condition changes? Because remember, the new score of 8, the vital signs monitoring should be continuous based on your news chart, isn't it? You can also write 15 minutes if you like. After 15 minutes, and if the patient condition changes. Or you can also write after 30 minutes, and if the patient condition changes. Are we all following? Yep. Okay. Next, so what are your interventions, Melvis? So John now is experiencing shortness of breath. So what are your interventions to help John breathe better?
Interventions will include John being settled in a safe environment. He is sat up in a sit right up position.
What is the medical term for sitting upright?
Semi-Fowler's position.
Fowler's or high Fowler's position. Okay, you can use these terms on your care plan. What else?
I will encourage breathing exercises like
Yeah, deep breathing exercises. Yeah, well
deep
done.
breathing exercises. Yeah. If they say he's on nebulizers, sorry, inhalers.
He's on inhaler.
Yeah. So I'll make sure I administer his inhalers at the required time. Take continuous observations as well.
What are we looking at? What do you need to calculate?
The news of the
News.
patient.
Well done. Make sure it should be there. Okay, should be there. What else? Are you going to refer the patient to the medical
Yeah,
team?
yeah, of course, because his temperature is more than 3, so it's an indicator to refer.
And also because he's struggling breathing, isn't it?
Yeah.
That's why you have to refer the patient immediately. Okay. So, well done, Melvis. So, how about on the other side?
Patient self-care activity.
Yeah, that's it.
Okay. Patient is able to breathe in or to breathe in normally by himself. Let's say patient can take his medication. Patient can take his medication by himself. Patient is responding positively to to treatment.
Anything else? That is it. Well done. Okay, well done, well done. So there is a pro tip that I will be showing you on my next slide. Okay, so this is a pro tip. Remember this one. If you're lost, you can use this as a structure of your care plan. Remember, when you're doing a care plan, you're telling a story. She said her problem will be John is experiencing shortness of breath with the spirit rate of 31. Are we all happy with that? Okay. Next is the aim of care. Melvis mentioned the aim of care is John will be able to breathe normally with a respiratory rate of 12 to 20. So that's his target. That's her target rather. Next is your evaluation date. So because we're talking about breathing, it's 31. Again, a score of 3 warrants a minimum of an hour. So after an hour, and if the patient condition changes, you can write it there. It's not asking you to write the actual date. Okay, on the examination, the date of the examination, you will only see the word today. Okay, on the examination, you're not expecting to see the actual date, but the word today. Okay, the word today. Next, let's go to the interventions. Melvis. So you've mentioned several or a couple of interventions. Help me complete these phrases, okay? So to make your care plan better. Let's start with the word assess. What are you going to assess?
I'm going to assess John's breathing or respiratory pattern, how he breathes in and out. Is there any sound? Is there any wheezing or any difficulties?
Well done. Or simply say, assess the patient's breathing pattern. Or breathing, that should be fine. Simplify
Yeah.
it, okay? So next, monitor, Melvis.
I'm going to monitor John's vital signs, particularly his temperature as he's spiking with 38.3.
Melvis, let's just focus on shortness of breath. Let's save temperature later.
Okay. All right.
So what are you going to
Yeah,
monitor? So you said vital signs. So once you've monitored the vital signs, what will you do with the vital signs or the observations? You total the,
new score and
that is it. That is it.
and
So you
escalate
just,
if fine.
so what you can write probably monitor the patient's observation and escalate probably the new score as per policy. Okay, so probably you can write monitor the patient's observation and escalate as per news policy. Because remember, the news is the basis what to do next. Okay, the news score will guide you on what to do next. Next is number 3, Melvis, administer. What are we going to administer to the patient based on the scenario?
Administer patients inhalers as prescribed.
That is it. Well done. Okay, and monitor its effectiveness. Okay, so if you write anything pertaining to medication, you will write administer the medication and monitor its effectiveness. So for in this case, in John's case, administer inhalers and monitor its effectiveness. Okay, got it? Provide, Melvis. So what are you going to provide to John? You've mentioned earlier a semi-fowler or a fowler's position.
Yeah.
And we write it there on that section.
Okay, provide or assess John in sitting up in a semi-fowler's position.
That is it. Well done, Melvin. Promote or encourage. What are you going to promote or encourage, John with?
I'm going to promote John in breathing, ambulating, so that they
Just
can.
pick one. Just pick one. You can write everything on there, okay? It will fill the whole space.
Okay, promote patients with these deep breathing exercises.
Well done. That is it. Or another word, yeah, that is it. Well done. How about educate, Melvis?
I'll educate the patient on
How
importance
about,
of importance of administration of drug.
well done. And remember, John is non-compliant to medication. Can we also think of educating John about the use of the technique? Probably his technique is wrong. Okay, so probably these are your other interventions. Okay, again, it depends on the scenario that will be given to you. So refer, Melvis, or escalate. What are we going to write in this section?
I'll escalate John if there is any deterioration with his news or his care. To the doctor in charge of his care.
Or the medical team. Can we also refer the patient to a respiratory nurse if it's relevant?
Of
Yep.
course, yeah.
Yep. So if it's relevant on the scenario, probably remember he's asthmatic. We never know. So that's why during assessment, you have to ask the patient. Probably one of your intervention is to refer the patient to the respiratory nurse. I hope you're enlightened with this kind of format, Melvis. Is this easier?
Yeah.
We are now left with the other section of the care plan, which is self-care activity. So the tip is to just mirror whatever interventions you've written previously. So let's say example, okay? I'll give you an example. Let's say one of Melvis's interventions is to assess the patient's or monitor the patient's observation and escalate as per news policy. Probably you can write on the other side, John will be able to understand the reason for checking the news, or John will be able to cooperate with the checking of the observations. Similar along those lines. Okay, another example is to say, um, let's say, educate John about proper inhaler technique. Probably what we will write on the other side is John will be able to demonstrate proper inhaler technique. Are we all following that kind of example? Another one is, let's say, educate John about deep breathing exercises. John will be able to demonstrate proper deep breathing technique. Sorry, give me one. This one.
John is compliant in or as accepted to meet the respiratory nurse with regards to his breathing.
That is it. So this section is what John can do for himself. If you're doing the new OSCE, this section is no longer existing. It's just intervention. Okay, so it's down to 14 minutes, but it's a different discussion. So for me, planning is one of the easiest station for the OSCE. Why? Because you can prepare your answers. Like say you're sitting at home, you're bored. Do your care plan for shortness of breath. Do your care plan for pain. Okay, let's do another care plan.
John is experiencing chest pain as rated on a scale on 5 on a scale of 0 to 10.
All right. You can simply say John is experiencing chest pain because of coughing with the pain score of 5.
5.
Yep,
Okay.
that is it. Simple as that. Okay.
Okay.
So what is your aim of care?
Aim of care to make John more comfortable and experience less pain.
So just to improve your problem. So if you say less pain, so what pain score are we looking at? So if you're again, remember measurable, isn't it? So less pain. What do you mean by less pain?
To bring the score down to 0.
Well done. Then probably you can put a range. Let's say 0 to 3. At
Okay.
least if you cannot reach 0, at least there's like, I mean, there's still like a leeway. Okay, 0 to 3, a range to make it realistic. Okay, but I think 5. It's reasonable to put it back down to 0.
Okay.
Okay, because it's like moderate pain, isn't it? All right. Well done, Punking. Let's move on. So, what is your reevaluation date following our format?
After 30 to 1 hour of nursing intervention, or when his condition changes.
Well done. Okay, well done. So you can just write either 30 minutes or an hour or 1 hour. Okay, because remember
Okay.
when we are dealing with pain, remember medication, oral medication, it will take an hour for it to take effect, isn't it?
Yeah.
IV medication will take like 15, 30 minutes
15
before
to
it
30
takes.
minutes.
Yep. So
Mhm.
depending on the scenario that you will be given, so if it's appropriate, tailor it on your scenario. Okay, but well
Okay.
done. So let's say
Okay.
after 30 minutes or after 1 hour, and if the patient can respond. For this particular scenario that I'm giving you, it's a chest pain because of coughing, not chest pain because of a heart attack, okay, or a
No.
heart problem. So it's a different story, okay? It's a different story. Based on our pro tip here on your screen, can you help me structure your care plan for pain?
Assess John's level of pain on a scale of 0 to 10.
And then what tool do we
5.
use for pain? Okay. So in here, we have this tool, what we call a pain assessment tool. Okay, a pain assessment tool. So yesterday, I've asked you, what does PQRST means or stands for?
Okay.
Can you
Yes.
help me, Funky? Okay, I think she did her assignment. Okay, when we are assessing pain, because some of pain is one of the loved care plans in the OSCE. So can you tell us something about the PQRST assessment?
The PQRS assessment is an assessment method where the P stands for provocation or palliation. That is, you ask the patient, how did the pain start? What were you doing when it started? Then the quality or the quantity. That's when you give the patient the scale. On a scale of 0 to 5, on a scale of 0 to 3, where is the pain? Then you also, on the quantity, you also tell the patient to describe the pain. Is it burning? Is it throbbing? Is it stabbing? Do you feel as if it's grinding? Tell the patient to describe the pain. Then R stands for the region or radiation. Where exactly are you feeling the pain? Let the patient touch. Then, is the pain radiating to somewhere else, or is it radiating from somewhere else? Okay, the pain is on your chest. Are you feeling it at your back? Are you feeling it at your hand? Let the patient tell you. Then the severity scale, and then the timing. The
Well done.
timing in terms of, do you feel it more maybe when you wake up in the morning? Does it disturb your sleep at night?
Well done. So the severity is your 0 to 10, okay? The
Okay.
severity is your scale, okay?
Okay.
So well done. Just to wrap up what Funky has mentioned. So P, the provocation or the precipitating factors. What's causing the pain? Q, the quality of the pain. So ask the patient to describe it. Is it dull, sharp, and like whatever Funky has mentioned, grinding, she said as well. PQRS, the severity. It's your scale from 0 to 10, 0 no pain, 10 being the highest pain ever. Can you please rate your pain? Um, PQR, radiation. What other body parts involved? Apart from your, let's say, remember when patients are experiencing heart attack, remember it radiates to other body parts like left shoulder, what else? Jaw. So those are the common radiating parts. And remember, at some point you've experienced pain, I believe. At some point you've experienced pain, so you know how it's like. Um, and then the timing, the duration of the pain. Okay, you can ask the question: is it while you, let's say, the pain you can feel it while moving, or while you're in bed, or this and that, and how long? Is it on and off? Is it continuous? So you don't need to write this all on your care plan. Okay, I'm just trying to touch this one because remember when you do your assessment, you might be asking these questions. Because some of the candidates they will only ask, can you please score your pain from 0 to 10? But you don't know where the pain is. You just assume it's there. Okay, so let's say there are actors wherein they will tell you, I'm in pain, nurse. So the next response is, can you please take your pain? But how will you know where's the pain? Okay, so you
Okay.
need to ask some more questions. So in the new OSCE, the PQRST or the pain assessment is a standalone station. Okay, so you're lucky you're not doing it. Okay, again, if you have friends doing the new OSCE, the pain assessment is a standalone station, and you will be asking these questions. Okay, so well done, Funky, for doing your assignment. Okay,
Okay.
let's carry on. So again, you don't need to write everything. It's just enough for you to say assess the patient's pain using the pain tool chart. That should be enough. Okay,
Okay.
and when you say pain tool chart, the PQRST is in there. Okay, the
Okay.
PQRST is all in there. Okay, well done. Let's carry
Okay.
on. Okay, how about monitor?
Yes, so monitor the patients or monitor the improvements in patient's pain using the pain scale.
So you're just repeating it then. I'll give it a tip. I'll help you with this. Can we also monitor, does pain affect the vital signs?
Yes.
Do we agree that pain can change blood pressure?
Yes.
That pain can change the pulse rate
Pulse.
and the rest.
Yes.
And also
And
respiration if you're in
and the
pain, isn't it?
respiration.
So
Yes.
is it also appropriate that we can write monitor the patient's observation and escalate as per news policy?
Okay.
Got it?
Okay.
So when
Yeah.
you're writing your care plan, think, is news appropriate for this scenario? Okay,
Okay.
let me cite another one. Let's say anxiety. Okay, anxiety. Some candidates they don't write this. If you're anxious, can anxiety change the patient's blood pressure observation? Yeah. At
Yes.
some point in your life, you've been anxious, especially
Mhm.
before examination. If you check your vital signs, definitely it's high. Okay,
Mhm.
so think if it's appropriate. See, so administer. So I hope you know what to say.
Administer the prescribed analgesic and monitor for its effectiveness.
Well done. That is there. Next one, Funke.
Then position
Hi.
patient
Yep, or whatever.
position patients in Fowler's position to aid proper breathing and reduce pain in the chest.
Educate. What are you going to educate the patient with? Okay.
Educates John on proper coughing technique.
Well done. Well done. So that's related to the pain. Remember, try to think what's causing the pain. Okay, so well done. Okay. What else?
Then another thing to educate John about is the use of his drugs,
Or about,
compliance to medication.
or probably let's save that for another care plan. We can
Yes,
also do like a non-compliance for medication, isn't it, as a care plan? Okay.
yes.
Well done. Refer or escalate.
Encourage John on copious fluid intake.
Well done. So to expectorate the phlegm. Okay.
Yes,
Or simply say,
yes.
encourage the patient to drink adequate or take adequate fluids.
Okay.
So that might be your care plan. So try to think what's causing the pain? What's the culprit? Because remember, pain is a symptom. Done. So guys, just a quick tip, okay? When so have you heard of a pain team before? Pain team. So in the trust or in here in the UK, we have what we call a pain team. So we only refer to them if the pain is chronic. Okay? If the pain is chronic, if the pain is idiopathic, we also refer cancer patients to them. Okay? If you cannot, because I see some care plans wherein, let's say, I'm complaining of, let's say, abdominal pain. Definitely, you will not immediately refer me to the pain team because the pain is acute. Okay, so when we say acute, normally it's less than 6 months. If it's chronic, if it's more than 6 months. Okay, we also refer the patients to the pain team if the pain is idiopathic. That means the pain is unknown. Okay, the pain is unknown. We've done everything, but the patient still complaining of pain. Okay, so sometimes cancer patient definitely if they need like stronger painkiller, because definitely if you're having patients having chest pain because of coughing, probably paracetamol, codeine can relieve the pain. Okay, so we normally refer patient to pain team if they want to start PCAs, okay, or higher, or narcotics or opioids, higher doses of medication. Okay, but not acute pain. Let's say I hurt my hand. I scored 6. Will you refer me to the pain team? Definitely not. Okay, they will just defer the referral. Okay, because you can probably give me codeine or paracetamol, or you can ask the medical doctors or the doctors in your wards to prescribe you something. All right. If
Mhm.
everything fails, that is the time you refer them to the pain team. Okay, if everything fails. So, can you help me? What are you going to write on the next section?
Okay. In the next session, I would write patients cooperated with ongoing news observation or ongoing observation.
Yep. What else?
Patients sat in bed in Fowler's position.
Yeah. What else?
John increased his fluid intake to about 3 to 4 glasses of water.
Yep. What else? Anything else you want to add, Hunky?
Then John demonstrated knowledge of coughing, of proper coughing technique.
Well done. That is it. Okay. So simple as that. Okay. So when you do another question, surprisingly nobody's asking me this question. So Emmer, how many interventions shall we write? Okay. So normally 6 or 7 interventions will fit on the paper. Okay. 6 or 7 interventions will fit on that paper. Okay. Again, you can only write inside the box. Okay, do not write outside the box or the table. You can only think outside of the box, but you cannot write outside of the box. The other side, or question, do I need to write everything on the other side? Probably like 4 or 5 will be fine. Okay, because you only have 15 minutes to complete this section or this particular station. Any question? Who's asking a question? Jones, do you have a question? Or do you want to give it a try?
Okay. I don't know how the script will look like on that day. I'm just concerned about the spaces provided on each line. If we are writing a point, if it is longer than a line, that means can we go to the second line? Or we should make sure it fits into a particular line?
That's a good question. So if you need to use the second line, then use it. Okay, because you cannot fit everything in just one line. Okay, so you can separate each intervention by bullets or by numbers.
And then,
Jones, do you want to try and give it a go? So we've done shortness of breath. We've done what's the other one? Pain. So what do you want to pick?
I'll pick FIFA.
Fever. Okay, let's go. Let's do fever. So what is your problem then?
John is experiencing fever with a temperature of 38.8 degrees centigrade.
Well done. See, you're following now. Well done. Next one. What's the aim of care?
The aim of care is that John's body temperature will drop to normal limits, 36
or change your word, drop probably like be back to normal levels, right? Or will return to normal range, and then you will write the normal range there.
Okay.
What's the normal range again, Jones? Help me.
36.5 to 38.
Oh, 38 is still a fever.
37.
37.5.
Okay.
Because even if it's 0, your patient still has a fever. Okay, all right. Let's move on, Jones. When is your evaluation date?
After 1 hour, or if patient's condition changes.
Well done. Because we know that after giving paracetamol, probably an hour, it makes it will take effect. Okay, well done. Yes, move on, Jones.
I will assess patient's temperature and record it. Secondly, I will monitor observations and escalate as per NILS 2 policy. Am I right to put NILS 2?
Yeah, well done. Or news will be fine. Okay, news 2 or news 2 will be fine. They understand it.
Okay. Then administer prescribed antipyretic and monitor effectiveness.
Well done. Next.
Okay.
I'm stuck.
Provide. Okay. Provide. I will ensure that the environment is conducive that is not hot for the patient.
Exactly.
By removing excessive clothing on the patient.
Well done. That is it.
Then I will educate. I will educate patients on the techniques of allowing it to be lost from the body, like teaching the patient on removing excess cloth at times. And,
I'll give you a hint, Jones. Okay, I'll give you a hint. If you're experiencing fever, think of hydration. So what will you educate the patient then? If you're having fever, can we not educate the patient something about hydration?
yes.
So what
Yes.
will you write then?
So I will educate the patient on the importance of hydration.
That is it. Or to drink adequate enough or fluid intake. Right?
Adequate fluid.
Well done. Refer or escalate.
I will refer to the medical team if the problem is not resolved.
Okay, or if the fever persists.
If the fever persists.
Well done. That is it. What will you write on the second part then, on the other side?
Then John will be able to describe his body temperature status.
Is he the one responsible doing that? Are you not the one who's checking it? Yeah, you're the one responsible checking it, not Joan, not John.
I'm looking at asking how are you feeling now, and he's
Oh,
saying
okay.
I'm better.
All right. Got it. Okay, what else, Jones?
John will be able to understand the importance of monitoring observations. John will be able to cooperate in removing excessive clothing on his body.
Yep, well done.
Okay.
Anything else?
John will be able to verbalize the effectiveness of medication taking.
Well done. So see, you're following. It sounds easier now. Are we all happy with this? Is this helpful? Um, Anything else you want to add, Jones?
John will be able to report deterioration in his health condition.
Well done. That can be, you can also add it. So please, guys, I don't want to see you writing document the care given, okay? Because the actual planning is the actual documentation. All right? I don't want to be seeing like interventions like gain consent because you've done that during assessment. The patient already agreed for you to carry on. Okay? So because these are like the fillers. You cannot think of any intervention. That's why you're writing it. Can you imagine? You're writing every time you will write gain consent, explain the procedure, document. Those are like fillers. Ruth, before we go for lunch, one more. So we've done pain, we've done shortness of breath, we've done fever. Oh, guys, before I move on, so I have you heard of the TSB before or the tepid sponge bath? Tepid sponge bath for fever. So with it's not a common practice here. Okay, if your patient is experiencing fever, we don't do that here. Okay, so I should not be seeing that intervention in your care plan. All right, so remember evidence-based practice and it should be current and best practice. I know back in, if you refer back to US textbooks, you will see tepid sponge bath. Okay, it's not a common practice in the UK. All right, next. Ruth, are you still there? Before we go for lunch.
Emma,
Shut,
I wanted to try the
shut.
fever.
Oh, you want fever? I will give you the challenge then. So I will give you the challenge. So I can see pain here done, shortness of breath. Um, so this is one of the hardest. Okay, are you up for the challenge, Miss Ruth? let's do let's do anxiety. Okay, let's do anxiety, Ruth. Let's follow the format and you will be fine. Okay, you will be fine. Again, it's our opportunity to try, okay? There's no harm trying. So what is your problem then?
Okay, so John is experiencing anxiety, but the problem is measuring anxiety.
That's fine.
The aim of care would be John's anxiety will be allayed.
are alleviated. Okay, to make the aim of care measurable, how about the words verbalize? Let's
Okay.
say John will verbalize.
Okay.
What is that? So what is that? So we're having trouble now, both of us. So John will be able to verbalize probably relief from anxiety, or John will be able to verbalize that he is less anxious probably.
Okay.
I don't know. If you can help me, if you can help us, we're
I think
struggling.
that I think that
Are we happy with that? Or will be free from anxiety? Okay. So verbalize might be the word measurable because that patient can only tell you that. Okay. All right.
okay,
Next,
so
what is your aim of care?
reevaluation.
I am revaluation date. Yeah.
Okay. So John will be re-evaluated or to be evaluated maybe after.
I'm anxious, Ruth. I'm anxious. I cannot breathe. So when
Okay.
are you going to evaluate me?
After an hour if his clinical condition changes.
Okay. So we have this, I mean, depending on the scenario, okay? Depending on the scenario. And can you imagine the patient is anxious going back to ICU and she's anxious, worried about his wife. So think, am I going to check the patient after a day or after 12 hours or after 8 hours? Probably not. Okay. So taper your evaluation based on the scenario. Use your clinical judgment. Okay. Use your clinical judgment. Well done, Ruth. You carry on. What are your interventions for anxiety?
Okay, so my first intervention will be to explain and discuss maybe aspects of his care.
Well done.
So they
Okay.
understand.
That's
Give,
that's that's very good. Okay. So this is one of the scenario we're in or care plan we're in. You have to explain because probably he's anxious because he doesn't know what the hell is happening to him. Okay. So well done, Ruth. Let's carry on.
so also educates patients on medications being administered during his stay in the hospital, and also for all okay, also encourage patients to ask questions related to his care and also
Well,
answering them in an understandable manner to the patient himself.
what kind of therapeutic communication are we using? Can we use open-ended question? Yeah.
Yeah.
Say, John, how are you feeling today? So allow the patient to verbalize feelings. Well done. So going back to the one year screen, Ruth, what do we need to assess or monitor?
Okay, I can assess and monitor his level of understanding of the care I'm providing him.
And going back to the vital signs, Ruth?
Okay, going back to the vital signs, because of the anxiety, monitoring his observation, because that could lead to maybe an increased pulse, respiration.
Exactly. Well done. Well done. Again, we've all been there, okay? We've all been there. We've been anxious at some point in our life. So we know that it can definitely change our observations. Okay, well done, Ruth. What else you want to add? How about so you said promote, how about administer?
I mean, most time we administer sedatives to calm them down if the condition can tolerate the drug.
Or, well done, sedatives or anxiolytics. Again, it depends on the scenario. I'm not saying you have to write this, but again, it depends on the scenario. Okay? Again, for the last time, you don't have to write this, but if it depends on the scenario. Okay? So sedatives or anxiolytics. Well done. And monitoring effectiveness. Anything else, Ruth, that you want to add? You happy with that? Or
Okay, maybe
fine?
providing information related to care, then also educating patients related to his care, answering questions.
How about the environment? If you're anxious, do
Okay,
we
yeah,
need to
also
remove?
providing a suitable environment. Maybe if the place is noisy, you can make it calm. Provide
Exactly.
distractions also for patients, like maybe a
Well
television.
done. Well done. So when you're writing care plan, think of the environment as well. So yeah, provide a quiet environment. Probably we remove stressors. Okay. So probably if the environment is quiet, it's settled, probably John will be able to come down. What are your patient self-care activities?
Okay. John verbalizing that he understands his care plan. John understanding him, verbalizing also that he understands education given related to medications and procedures being carried out on him. Then John actively participating also in the procedures to be able to, as in, to for him to understand, know what is going on. I think actively participating will also be anxiety.
Done. Okay, Melvis, any question?
I wanted to ask that, is John's worries with regards to his wife pregnant related to his can it be put together with anxious going
Yep.
to the intensive care as an anxiety?
Yep, that's yeah.
Can that all be interrelated?
That's
Okay.
one problem. So the problem will be anxiety. Okay?
All right.
Yeah, that's anxiety. So can you imagine the wife is pregnant, is going to ICU, definitely it creates a lot of stress. Okay? The stress causes anxiety. Okay? Are you happy with my answer, Melvis?
Very happy.
Okay, all right. Yeah.
So Emma, can we say anxiety due to his wife who is pregnant or due to going back to intensive care? Can it be written like that?
It doesn't matter. Okay? It doesn't really matter. For as long as the actual problem, which is anxiety, is there.
Anxiety.
The simple problems like anxiety are the hardest ones to make. Am I correct? Compared to pain, compared to shortness of breath, compared to fever, we know what to write. But so these like subjective problems like anxiety, these are harder to make. Am I correct? Okay. So my challenge for you guys, I know you know the 8 scenarios for the OSCE. So the 8 scenarios for the OSCE are fall and fractures. Fall and fracture. So what are the possible care plans for fall and fracture? Let's say next is subdural hematoma. So what are the possible care plans for subdural hematoma? Think of that scenario. Next is hernia. Okay? Hernia. What are the possible care plans for the hernia? Will the patient be in pain? Do you think? Will the patient undergo a surgery? So what will be your care plans post-op? Okay, think of post-op patient. Think of pre-op patient. So what will be your care plans? What else? The other scenarios are help me, Jamie. What are the other one? Depression. Yeah. So see, depression for me one of the hardest care plans. So what care plan will you make? What if your patient experiencing malnutrition? Okay, so what are your care plans? And then what if your patient is diabetic? Okay, what are your care plans? What if your patient is hypertensive? What is your care plan? What if your patient is let's say the patient was diagnosed with ectopic pregnancy? Think of surgery as well. Okay, think of a patient losing a child. So what will be your care plan? So asthma and pneumonia. How about a patient with heart failure, with heart problem? So what might be the possible care plans for them? So that's why I'm telling you this is a particular station of the API we're in. You can write your answers in advance. So my tip when I did my examination, let's say pain, I wrote 15 possible interventions. Okay, so whenever I deal with pain, at least I can just select which one is appropriate for the scenario. Okay, so that's a good practice. Let's say shortness of breath, write 15 intervention and then just select which are the interventions appropriate for the scenario that will be given to you. Always remember this. The tool used during assessment must be written in your care plan. Let's say during your assessment, you've used news. I should be seeing news written in your care plan. Okay? If you've used, let's say, PHQ9, at least in one of your care plans, I should be able to see the assessment tool used. That is PHQ9. Let's say you've used MUST. Let's say the scenario is about malnutrition. I should be able to see the MUST written in your care plans, in one of your care plans. Okay? If you're in the community, you're not expecting to see news, probably the TPR should be written in somewhere. We had a fail before, wherein the scenario, it was about neuroobs. And the GCS were not written. It's nowhere to be found in any of the care plans. Okay? So can you imagine you're writing something about, let's say, confusion. That's the care plan. and the GCS or the neurological assessment were not written. It's nowhere to be found. So how will I know that it was the scenario? Okay, so always remember this. Okay, always remember it will be an automatic fail if the assessment tool is not written in there. Okay,